So many times I hear this question of how do I know if I'm progressing if I'm not going to get cervical exams, or how do I know if my cervix is dilating, or how do I know if things are moving along? Well, there are actually a lot of ways that we can know if things are moving on, and I want to talk about 5 different things that you can do while you're in labor, or your partner can observe while you're in labor, to know if labor is progressing without getting a vaginal exam. If this is your first time here, my name is Chanel. I'm a working mama, and I'm so happy that you are here and ready to become educated and empowered so that you can have a fearless and empowered natural birth. Now, if you have not subscribed to this channel, please make sure you do so. I do share videos every single week on how to become prepared for your birth. Also, if you're not following me on Instagram, make sure you do that at A Working Mama, where I share daily tips and tricks on how to have a fearless and empowered natural birth. Now, for the reason that you're here, let's go through these things. So often we hear from our providers that we must have cervical exams in order to know if we are progressing in labor or dilating. Now, if you haven't seen my stations video, I will make sure to link it down in the description below. Make sure that you watch that because it will make sense when I describe some of the things that I'm going to talk about in this video. Also, if you have not watched my Stages of Labor mini course, that's also going to be helpful. I will link it in the description below so that you can get an idea of what's going to happen in early labor, active labor, when you're pushing. What should you be expecting? So make sure that you guys check those out either before or after this video so that all of these things kind of make sense and will come together for the beginning to the end of labor. Now, cervical exams. Let's start there. What are they? Are they necessary? And what do they tell us? Well, cervical exams, also known as vaginal exams, are a way for our providers to get an idea of how dilated we are. Now, of course, we need to get to 10 centimeters to meet our babies, or for our bodies to potentially begin getting ready to push our babies out. But that isn't always the good determining factor of how far along we are in labor or how much longer we have to go in labor, because there's a thing called stations that, if you are not familiar with those might actually give us a better identifying factor of where our bodies are and where our babies are in labor and what we need to be doing according to the station of our baby. But the reason that we do cervical exams, or that our providers do cervical exams, so that they can get an idea of either the station of the baby or how dilated you are, to get an idea of where you're at in labor and or if you're progressing. But the reality of cervical exams is that they're uncomfortable. If you've asked any mama who's gone through labor before, having to stop what you're doing if you're moving around, get on the bed, get on your back, spread your knees open, and let somebody take 2 fingers and check your vagina, you'll know that it's not that comfortable. And it can take you out of your birth zone. So I like to encourage women to know what other alternatives there are to cervical exams to know how your body is progressing in labor, so that we can avoid any sort of invasive experience other than meeting our baby. Now, the first thing that we can do to know if our body is progressing is look at this thing called the purple line. Now, it only occurs on about 75% of women's bodies, but there is such a thing called the purple line that will show up on our butt crack. If your skin is a little bit darker, it may show up as a white or a silverish line. When you're about 3 or 4 centimeters, this is when it usually starts to show up. You may see it at the top of your butt crack, really, really lightly, really, really briefly, but it's not going to be something that's super obvious. However, as the line starts to progress above your butt crack, going towards your sacrum, that is how we know that things are starting to progress. And the longer the line becomes, or the more visible the line becomes, the more we are seeing that there's progression in labor. Now again, you mama are probably not going to be able to see this. You may not even be paying attention to this, but it is a way for us to see if labor is progressing. This is something that your partner can look at, the nurses can look at. They may not be as familiar with this sort of way of knowing that your body is progressing, but it is a way that some women have shown and seen that their baby is progressing or descending on top of other factors. Now, if the purple line test or the silver line test, depending on the tone of your skin, doesn't show up, there's another way that we can see if our body is progressing in labor, and this is our contraction pattern. Now, if you go through my Stages of Labor mini course, which is free and it's on this channel, make sure that you check in the description below, you will know how to know that you're in early labor, active labor, transition, or pushing. Now, as you understand the stages of labor, we will also notice that our contraction pattern will change as we get closer to meeting our baby. So in early labor, your contractions will be something more than 5 minutes apart. Your contractions could be 6 minutes, 7 minutes, 15 minutes apart. We don't know, but it's going to be more than 5 minutes apart. As you start to progress into active labor, your contraction pattern will become 4 minutes apart or 3 minutes apart, or something along those lines that are 5 or less minutes apart. And if we pay attention to that contraction pattern, usually what happens is as we progress through those stages of labor, our contraction pattern begins to come closer together, meaning that our contractions are happening more often. We're not getting as much time in between them, and we're seeing that happen consistently. That is a sign of progression, because if your contractions usually start happening and they're closer together and they're getting more intense, that is a sign that things are getting closer to that transition pushing phase. So it's important that as we are considering progression when it comes to labor, sometimes dilation is not always going to match some of these other factors. And these other factors, such as your contraction pattern or the purple line test or understanding the stations of your baby, those are going to give us a better idea of where we're at in labor or if things are progressing. Now, not to worry if things are not progressing super quick, because what you should remember is that labor is not some sort of mathematical equation. It is not A plus B equals C, and it doesn't happen the same for every woman. For some women, they will take a little bit longer to get from 0 to 10. For some women, it takes them longer to get from 0 to 6 than it takes them to get from 6 centimeters to 10 centimeters, which 6 centimeters is usually what we would qualify as active labor. Okay, so if you're getting cervical exams, once you're about 6 centimeters, that will be active labor. However, we don't have to know that we're 6 centimeters if we understand our contraction pattern, which typically says when we're about a 4-1-1 or 4 minutes apart, lasting for 1 minute, and those contractions have been happening for an hour, that typically tells us that our body is in active labor. We don't need to know if we're at 6 centimeters or not for that to be the case. So keep those things in mind, that your contraction pattern tells us a lot about where you're at or if you're progressing in labor. Now, the next thing that we can look at to know if our bodies are progressing in labor is how your body is moving. Based on the station of your baby, that means how high or how low or engaged your baby is in the pelvis, your body will make its own natural movements, either front to back or side to side, based on where your baby is at in the pelvis. Again, this is the station of your baby, how high or how low or engaged your baby is. And if we understand stations of our baby, we will understand that our bodies will move in certain directions on its own, and that will give us an idea of what station baby is in. So if you understand stations versus dilation, which is again the video that I have linked below, you will understand that the station of your baby is actually a better determining factor of you progressing in labor than how dilated you are. And that means that your baby could be low or a positive station in your pelvis, but you could still be at 6 centimeters. And you can think in your mind, oh my gosh, I have so much longer to go. When in reality, you just lift up your leg or you change positions, you can go from a 6 to a 10 in 30 minutes. But if you are not moving, or you're not doing the right movements at the right time based on the station of your baby, because you don't even know to look at that, you're just thinking about this number, then you could be doing something that's not actually helping open up your pelvis in the right area. And it can take you a lot longer, double or triple the amount of time to go from a 6 to a 10, because you're not being intentional about the type of movements that you're doing. So that's why it's important to understand stations of your baby and understand how your body actually tells you the station of your baby, so that you can then turn around and do the proper movements and get an idea of, oh, my body was moving like this before, but now it's moving like that. My baby must have descended. And on that note, another way that we will know that your body is progressing in labor is pressure. I always tell mamas, pressure is progress. If you're feeling pressure, that is a good thing. While we may not feel that great in the process of feeling more pressure in labor, if you are experiencing more pressure, understanding the stations of your baby, the more pressure you're feeling, there's a good chance that means that your baby is descending, meaning getting lower in your pelvis or getting more engaged in your pelvis. And that's what we need to happen in order for this baby to come out of your body. So pressure is progress. If there is a position or a movement that you feel brings more pressure, do not shy away from that. Go to that place. May not have to be there for super long, but if sitting on the birth wall brings a lot of pressure during a contraction, that might be a good place for you to be. So keep in mind that pressure is progress. Pressure is a good thing, and it tells us that the more pressure we feel, the lower our baby is getting. And then lastly, what is actually coming out of our bodies? As we progress in labor, we will start to see more mucus plug being lost. If you haven't lost it completely already, we will start to see more bloody show, and your water could potentially break as labor progresses. If you start to see bloody show in early labor, which is very normal, what you will notice is that as labor progresses, you're going to start to see more bloody show, or it might become more bright red. Or if you're losing your mucus plug every time you go to the bathroom during labor, maybe you're starting to see that as you are progressing in labor and as time is going on, you're starting to see more mucus plug being lost. Maybe when you get to transition, you start to notice that your water has broken, or you feel a big pop, and that is your water breaking. That is a sign that things are progressing. But you have to understand what's going on in your body in order to know that those are things that are normal and good things, versus seeing bloody show, seeing mucus plug, or your water breaking while you're in labor and freaking out and thinking that's a bad thing. So it's important to understand that there are so many other ways to listen to our body to know how well our bodies are progressing in labor. And in most cases, these are going to be much better determining factors that things are progressing along. I hope this video was helpful. Of course, always make sure that you educate yourself throughout this entire journey so that you can do what you feel is most comfortable. Or if you are doing something, that you're at least asking and advocating for the proper information that is going to help you make an informed decision. As always, I am rooting for you, mama. You are going to work your birth. I'm so excited that you're here and just willing to educate yourself for the big day. I know it's going to be a beautiful and empowering experience. If you want, I do have a full childbirth education course that will take you from step 1 of really working through the mental preparation to step 4 of making sure that you know how to intentionally move your body throughout labor. So if you want to check that out, it is an online self-paced course called Work Your Birth. That is also in the description below. You can check that out and make sure that you and your partner are prepared for your birth. I love you all. I'm so happy that you're here, and I can't wait to see you on the next video.